welcome today. So today is all about allied health, and we have the wonderful Kara Schotter with us today. So Kara, how about you go ahead and introduce yourself and tell us your title and how long you've been here with Jefferson.
Hi, I've been at Jefferson 9 years, and I have been in the leadership role within the Allied Health Department for 6 years.
That's awesome. So you are the Dean of Allied Health, which is wonderful. So what does it mean to be the Dean? What are you in charge of at Jefferson?
Yeah, so in the Allied Health Department, we have 10 programs with faculty teaching in those programs, and my responsibility as the dean is to make sure that the faculty and the students within those programs are working together to ensure that the students are successful within their program of study, and to address any college-related things that come up during a student's experience at Jefferson.
Awesome. So do you teach any classes yourself?
I do. I'm actually currently teaching medical terminology classes, so that teaching is one of my responsibilities also, even in addition to my leadership role. So, yeah, if a student enrolls in a medical terminology class, I'm currently teaching the in-person classes, and I also teach some online learn on demand health health science technology courses. Specifically, it's a pharmacology course that a lot of students that are interested in nursing complete. So that course is HST 121.
Okay. Is there a favorite course that you've ever either taken or that you teach currently that you have?
I have to say that pharmacy technology is my favorite. I started out as a full-time instructor in the pharmacy tech program, so that is definitely my favorite program that we offer in Allied Health. And it's really just because I started out working as a pharmacy tech myself many years ago, right out of high school. So, yeah.
So you have been in the world of education for a long time. That is fantastic.
Yes.
And I totally forgot to introduce myself, but I've done these before. Hopefully you've seen my face before, but I'm Elizabeth Teeter and I'm the Associate Director of Admissions. So, but enough about me. Today is all about Kara. So, and can you just explain for everyone what allied health really means and how it might be different from either when you say the medical field specifically or nursing, or what does allied health really mean?
Sure. Allied health, overall, what that means is uh, it is the cooperation that exists within a patient's care. And what I mean by that is, um, in addition to having nurses that care for patients, we have respiratory therapists that care for the patient. We have medical laboratory technicians that work in the lab and process blood samples, urine samples, and other types of tissue samples. Um, we have medical assistants that work in doctors' offices alongside doctors to help care for patients, surgical technologists. So the whole gamut of everyone that is involved in patient care, in addition to a nurse and a doctor that are engaging in that care for the patient.
That's fantastic. So I know that a lot of students right now, especially during this pandemic, are really interested in getting in to allied health. So what kind of money can a student really expect to make once they graduate from one of our allied health programs at Jefferson?
That really varies. Some of our programs that we have are short-term programs, and what I mean by that is they take a year at the longest to complete. So the short-term programs typically don't pay an hourly wage that's comparable to a program that takes a little bit longer to complete. So a pharmacy technician can typically expect to start out making between $12 and $16 an hour, and our pharmacy tech program lasts a year. Medical assisting is also a program that we have that's a year-long program, and the pay rate is about the same for that program. Uh, And then our programs that are 2-year programs, like physical therapy assisting and occupational therapy assisting and radiography, those programs are 2-year programs. So students have to take some prerequisite classes before they're eligible to um, apply for admission to those programs, and then it takes 2 years once a student is in the program to complete the program. So that typically within those programs, they can make 35,000 and on up in terms of the salary. So it's kind of hitting that middle of the road kind of salary, and with experience that increases.
That's awesome. And it looks like we actually have a question that's coming in the comments right now. So Mariah asks, so if the pharmacology class is not available at my Jefferson campus, but is available at another location within Jefferson, can I take it, or is it a whole new transfer process?
Okay, so pharmacology, if that would depend on if Mariah, if you're specifically wondering about the HST 121 course, or if you're wondering about our pharmacy technician courses, because they're kind of two separate things. The HST 121 course is an online course, and anyone actually in the KCTCS system can sign up to take that Learn on Demand course. So it is, since it's online, it does not involve a transfer process for any student that's in the KCTCS system. You can just enroll in one of the courses when we offer the course, and we have different start dates and times for that course. So that is open, like I said, to anyone. Now, Pharmacy Tech, we offer as kind of a hybrid model. We have some Pharmacy Tech classes that are online, and we have some lab components that are required for that program that happen at our downtown campus. So that would require some attendance to, an in-person kind of class. But again, even if you're attending courses within Jefferson, you can take classes on any of the campuses and there's no transfer involved.
Yes, within Jefferson, we can make it happen for you. And it looks like Mariah was specifically inquiring about the HST course.
Okay. And I think I answered that. If there's anything else, Mariah, definitely let us know.
Yeah, and this is a great time. If you are interested in allied health and you would like to ask some questions to the expert, please mention in the comments. We're happy to answer any and all questions. And just to kind of give everyone an overview of the 10 programs, Kara, would you mind just kind of listing them out 1 through 10?
Absolutely. I've got my cheat sheet for that reason, because I don't want to forget a program.
That's awesome. And if you want like a short blurb about each program, I know we've kind of mentioned some in passing, but I think it's nice for students to know everything that we have to offer from top to bottom.
Absolutely. So I'll give a list, and as I'm going through the list, I will give you just a brief description as to what that career would look like. Okay. So we have a health information technology program. That program specifically focuses on working with patients' medical records in the electronic system that exist in a hospital setting, in a doctor's office, maintaining those records, and on the back end of that, billing insurance companies, patients, all of that for the care that's been given in either, like I said, in a doctor's office or a hospital setting. So we've got to have someone to manage those medical records, and that is a health information technologist. We have a medical assisting program, and that is, mentioned that previously, that is working alongside a doctor, typically to take patient vital signs. So when you go into a doctor's office, the person that takes you back to the room where you wait for the doctor to come in and see you, when you get your temperature checked, your weight checked, your oxygen level, all of those things are typically done by a medical assistant. So a medical assistant has that skill set to work alongside the doctor to make sure that everything is getting documented in relation to a patient's need for care. Medical coding and reimbursement specialist is another one of our programs. That is actually a certificate program that we have, and that is offered in a year. So that program works alongside those professionals, I should say, typically work alongside a health information technologist to maintain the billing and coding side of what happens when you go to a hospital for care. So your insurance pays the bill that goes along with what care you received. So that's kind of what a medical coding and reimbursement specialist does. We also have a medical laboratory technician, and I mentioned that one previously. That those professionals work in a laboratory setting. And processing those samples, the blood sample that you give at a doctor's office or in a hospital, looking at urine samples and doing a urinalysis to identify what antibiotic maybe you need to treat a bladder infection, or looking at a bacterial swab to determine what kind of antibiotic would help that patient. So the work of a lab tech is very diverse in terms of looking at the samples that are collected from a patient in helping the doctor treat that patient. Um, we have occupational therapy assisting, and that is working alongside an occupational therapist. We also have physical therapist assisting, and that is working alongside a physical therapist. So there's a little bit of a difference between those two programs. An occupational therapist assistant really, and an occupational therapist, I should say, that is, the professional that an OTA works alongside is uh, focusing on daily life. So the tasks that we all take for granted, being able to cook a meal if you've had some sort of an injury, being able to return to work with adaptations that allow you to perform your job. Um, and the difference between that and physical therapy assisting is, and being a physical therapist also, is that the physical therapist side of things focuses on muscle movement. So focusing specifically on being able to walk and being able to regain strength if you've been in some sort of an accident or had an injury. So the two do go hand in hand. The professionals do work together within the two fields, but they're very specific in the niche that they are filling. So very different though, in, like I said, the in that focus. Um, we also have paramedic technology and emergency medical technology, um, and those two programs kind of fit together also. So in order to pursue a career as a paramedic, you have to start out as an emergency medical technician first. And emergency medical technicians and paramedics both ride in the back of an ambulance and deliver that on-scene care when someone has been involved in some sort of an accident, or has some sort of a health condition, wherever they are. If they have a heart attack and they're at home, or if they have a stroke and they need assistance getting to the hospital. So an emergency medical technician has a basic level of knowledge to be able to deliver the care to sustain that person's life, or bring that person back to life, even if they've if they need that type of care. So they have that skill set to get that person to the hospital to get the additional care that they need. A paramedic has a little bit more advanced skill set, so they have more understanding and knowledge about how to sustain someone's life in that emergency situation. They are able to deliver medications that an EMT cannot. They're able to intubate someone, so put a tube down their throat if they're not able to breathe. They're able to do some more care than what an EMT is able to do. But like I said, to be a paramedic, you have to start out as an EMT first. And it's just that step up from that in terms of the education. And we have a pharmacy technician program, and I mentioned that. That is, like I said, that's one of my favorites because of my own experience being a pharmacy tech. So that is one of our shorter term programs, and we have a stackable credential in that program where we have an entry level technician certification. And it leads to a national certification also that allows someone to be able to work in a retail setting or a long-term care setting. And then once a student has completed kind of the entry-level certificate, we have a diploma in that program, and that diploma piece focuses on the skill sets that are needed to work in a hospital. So making IV medications and working alongside a pharmacist in a hospital setting. So something I always like to clarify about pharmacy techs is that when you step up to a counter at a pharmacy, most of the people working behind that counter are technicians. They're not all pharmacists, because a pharmacist, you can have one pharmacist that kind of oversees the work of several technicians, to make sure that prescriptions are getting filled and labeled and ready for you to pick up when you go to the pharmacy to pick up your medication. Um, I mentioned physical therapist assistant already. Let's see. We have radiography, so learning how to make X-rays. So taking those X-rays, positioning the patient, making sure that the contrast is a good level of contrast on an X-ray, so a doctor can look at the X-ray and determine what if someone has a broken bone or what other condition that they have based on that X-ray. So that's another program that we have. And then we have respiratory care, and that's a very common career right now that's getting a lot of attention from COVID, because a respiratory therapist is very, very important in the role of treating a patient that has COVID, because a respiratory therapist is the professional that delivers the breathing treatments and the medications that are delivered directly into the lungs to treat lung conditions. So that is, like I said, a profession that has gotten a lot of attention recently, and there is a demand for respiratory therapists, and there was a demand even prior to COVID. Lots of job openings exist in that area. Um, and the final program that we have is surgical technology, and there's also a demand for surgical technologists. And though a surgical technologist works alongside a surgeon during a surgery, handing that professional tools, making sure that the sterile field is maintained, meaning that anything that could harm the patient during the surgery in terms of bacteria or anything else is, kept out of the area where the surgery is occurring. Because maintaining sterility during a surgery is extremely important to make sure that that patient recovers from the surgery without having any complications. So that is kind of the gamut of the programs that we have in allied health, and would be glad to answer any questions that anybody has, or if you have questions for me, Elizabeth. What do we have next?
So really and truly, I thank you so much for going through all of those programs. We have a lot to choose from. And I know that when most people think of Jefferson, they think of open doors, right? Because our doors are always open. But I do want to emphasize that some of these programs are very specific, and they have different requirements because of the level of care that our students and graduates are going to be providing. So some of these programs are what we term selective admissions.
Mhm.
So I'm wondering if you can kind of go over what selective admissions is, and then we can even take a look at an example of what that means and how we can find it on our website.
Yes. So selective admission, what that means is, in order to start a program at the college, especially in allied health, um, and in nursing also, um, there are prerequisite courses that have to be completed. And what I mean by prerequisites, that means that a student has to take anatomy and physiology typically. They might have to take an English course. There's communication classes. It really depends on which of the programs a student's interested in applying in, what courses they have to take in order to demonstrate some basic level competencies that are expected for a student to be successful within one of the programs. So one of the examples is our physical therapist assistant program, and it has the reason I picked this program is we get lots of applicants for this program every year, and it has some very specific criteria as to what's required for that application. And all of that information for all of our allied health programs can be found on our website. So this is just an example here of our physical therapist assistant website and all the information that is there. So once a student has completed those prerequisites, they can apply to the program for admission. Most of our programs start in the fall semester. The exception to that is our OTA program. And it starts our occupational therapy assistant program, and it typically starts a cohort of students in January every year. So the application deadline for that program is a little bit different than the majority of our other programs. But still, it has those prerequisite courses that students have to complete before that application process. And once a student has completed an application, their name goes into a pool of students, and that pool is then analyzed based on the admission criteria for the program. And the admission criteria typically include GPA, the and the completion of a background check and drug screen, um, those general education courses equate to specific point values and specifically in relation to the letter grade earned in the course. And the reason we have that selective admission process is because we have to narrow that pool of students. We want to accept the students that are the most prepared that we expect to be successful in the program, because we receive more applicants typically for most of our programs than we have seats available in the program. So for PTA, for example, we accept 22 students every year, and we end up having around 100 applicants every year. So some students are not getting accepted into the program, and they very well might have taken all those prerequisite courses, but because of the scoring that occurs in that selective admission process and the number of seats that we have to narrow that pool to the pool of students that's the most ready for the program.
Yes. And I just want to kind of reiterate that we are always here to help. And so if students need help just either applying to Jefferson for the first time, or if they have applied to Jefferson and they want more information about what they need to do for the selective admission program that they're interested in, the admissions office is here to help. So you can always contact us at jf-recruitment@kctcs.edu, or you can call 502-213-2624, and our team is super happy to help. We can help answer any questions. We can schedule a time to chat with you either over the phone or through video chat, and kind of walk you through the process and go over those individual curriculum guides with you. Now, at the end of the day, the admissions office can help, prepare you for what you need to do for that selective admissions procedure. But just keep in mind that selective means selective. And if you have any questions at all about something that's very specific to the program, we're happy to get you in contact with whoever the program coordinator is so you can work one-on-one with them. And then we'll also help you if you need help signing up for a pre-admission conference date or really just accessing any kind of general information whatsoever. We are always here to help. Please contact us. We will make it work for you. And I just kind of wanted to reiterate one last time, if anyone has questions, feel free to pop them in the comment section. We will try to answer those. But while we wait for that, I just wanted to ask Kara, do you have any advice, or what advice would you give to a student who is interested in pursuing a career in allied health?
The advice that I have, it goes right alongside what you mentioned in terms of ask those questions, right? because the advice that a professional working in the field that you think you may be interested in may be the advice that will help you decide if a program of study and a career is a fit for you. So get in touch with someone that has background experience in the field that you are interested in. And if you're not sure, if you're like, do I want to be a surge tech, or do I want to be a PTA? Do I want to be a physical therapist assistant? Contact someone in both areas and get that feedback from them about what that profession looks like. I gave you just a very brief description of each of the programs. Someone that works within a profession can definitely give you advice that is worth hearing. And if you can get a opportunity to job shadow, that is another piece of advice that I have is dig in. Norton, I will say, and Baptist and a lot of the other healthcare agencies locally will allow you to job shadow. Um, with COVID, it may be sort of difficult to find that opportunity, but I know that you can even look up YouTube videos about professions if you have questions. And I would even go as far as to say the faculty in allied health are more than happy to answer any questions that you have about a profession and what that career is going to look like. And to that note, I would also add, uh, this session is really focused on admission to the college and identifying that program, but we also know that students that are already Jefferson students may view this video on Facebook. And if you have questions, please reach out to our advising center, or you can email me. My email address is Kara, Kara .schotter@kctcs.edu, and I can get you connected with our program faculty. That information is also available on the college website. And like I said, our faculty in allied health, I will say, are cheerleaders for students, and really want to help you identify that career that is the right fit for you. So definitely, if you have questions and you're already a student at Jefferson, or you're thinking about applying, please don't hesitate to reach out. We want to help you.
I love that, and I love that you mentioned that questions are always welcome, and that's something at Jefferson across the board that we encourage. If you have questions, ask them. We are happy to answer and kind of dig with you to figure out what's going to be best for you. And I just want to mention again that Allied Health has such a wide range of programs that can fit pretty much any personality type. So if you want to be more behind the scenes, we have programs for that. If you are a people person and you want to be, helping patients and talking with them and, figuring out what's going on, there's programs for that too. So it's really what is going to be a good fit for you and what is going to be a good fit education-wise, time frame-wise. And the great thing about Jefferson is that we are so affordable, and we have lots of different ways to help students pay for college. So if the cost of college is the only thing that's holding you back, please reach out to that JF recruitment email, and I will find a way to work with you to figure out how we can help you pay for college. There's so many different options. There's scholarships, there's outside partnerships, there's different, employee tuition assistance programs that we can help you with. So if that's the only thing that's been holding you back this entire time, again, please shoot us an email, call us at this number that's on the screen, and we will work with you to figure out what we can do to help. So again, I just wanted to thank you, Kara, for taking the time out of your afternoon. I know as the dean, you have so many different responsibilities and you're teaching and you're doing all this. And thank you so much for taking half an hour to chat with me today and really promote the allied health programs at Jefferson. So with that, we will bid you adieu. And thank you everyone for joining us today, and we will talk to you again soon.
Thank you.